now Ballad, as a CNA. He then went on to attend nursing school, all the while working at Ballad as a nurse intern, a CNA, then a nurse intern 1, 2, and 3, graduate nurse, and then becoming an RN. During his time working in all these roles, he served as an excellent preceptor to our students during their clinical experience. We miss being able to put our students with you as an unlicensed person. He has achieved a Bachelor's of Nursing degree and is currently working as an RN with Ballad at JCMC. I could not be more proud to have our program be a small step in your journey. Please welcome Samuel Mitchell.
All right, so if this isn't a good position, I can always have a booming voice. I'm a musician, so I can speak loudly if I need to. All right, so I've got this little paper here, and as you'll find out in your nursing experiences, you can always start off really well, but then you have more stuff to add. So if I'm a little scattered, it's because of, oh, that's good, good, you need to bring that. All right, so like she said, I'm currently with Health Pro Staffing. I'm pre-assigned to the orthopedic unit at Johnson City Med Center. I've seen a few of you. I know this isn't everyone who was in the class, so some of your classmates who aren't here may have worked with me and my CNAs on the job. So I've been a nurse about a year and a half, and I just started off as a nurse mentor, so I'll be helping guide new graduate nurses who are just they're starting out in their first year as nurses, and I'll be helping them in a way that's not really like a preceptorship, but it's more of a off-the-job kind of pick my brain. What was your experience? How did you handle this in a more intrapersonal, extracurricular kind of thing? So you might be thinking, why is this guy up here who's just a nurse? Never bring that up again. Just a nurse or just a CNA. Don't let that cross your lips. I'm sure you've heard that before. And so you might want to know where I came from. So I started off, I grew up in Nashville, not Asheville for those of you who get those mixed up. Nashville. It's a little farther away. And then I went to Middle Tennessee State University and I got my bachelor's in chemistry. Because I was pre-med. I wanted to go to medical school. After a little bit, I went to Lincoln Memorial University up in Harrogate, a teeny tiny little town. And I was in the Doctor of Osteopathic Medicine program for a year and a half. If you ask me how that went, I'm a nurse now. That tells you anything. So it was probably the most anxiety-ridden, terrible time that I can recall. I learned a lot about myself. I learned a lot about medicine also, but stuff that I can use to help my patients. But it ultimately was not for me. I went on a leave of absence and I was given the choice to return to school. But I said, that's not really not gonna happen. I can't put myself through that again. And it was during that time I actually went through white coat ceremony. So I understand the importance of ceremony and charting those different moments in life and telling you, this is a graduation ceremony. Well, you didn't go to school necessarily. You went to classes, but this is still a hugely important milestone in your life because she might call it a small stepping stone, but this was huge for me because I went into the CNA program thinking, I just want some more clinical time. I want some more exposure to patients. And it turns out I was getting my eyes open to nursing and saying, well, this is really a lot more my speed. I want to talk to people. I want to spend time with them. I want to spend the 11 hours and 55 minutes that the doctor's not there in the room with them. And so that's kind of what opened my eyes to nursing school when I said I didn't want to go back to med school. So I went to ETSU and I went through a pinning ceremony where I also was recognized at that point. And ever since then I've been working with Health Pro Staffing. Future plans, I want to go on and get my master's in nursing, starting next fall, hopefully, in administration, and then get my postmaster's certificate in education, so I can become someone who not only precepts, but instructs people and educates them on nursing and how they can do better in not just patient care, but interprofessional communication and all these important facets of healthcare that we tend to forget. Let's see. So I wanted to, I'm sure you've heard of the big white hospital in the sky. Has Tina not brought that up? Do you still bring up that? Yeah, so everything that we teach you and that you've been taught happens in this big white hospital in the sky, where that's your only job right then, is to do that one task, and everything's gonna be great. Just do it exactly how they're instructed to, and that's how you should do it in your check-off exam for your certificate. But it's not like that, obviously. You've been in the clinical setting, you know that things are ridiculous right now. We have shortages of staff, we have shortages of CNAs and nurses and even physicians now. Fewer people doing more work is an easy way to say it. It's not easy to do it, I can tell you that. And being a CNA, that's a totally different ballgame from being an RN. You have a lot more patients than I have to deal with, but you are my eyes and ears. You go out there and you tell me if that patient needs medicine, or if they've got a spot on them that doesn't look quite right, or they've had some shortness of breath. Can you talk to them and get some medicine for them? And it's happening a lot more frequently now. We have increasing acuity. Patients are getting sicker. Before they come to the hospital, they are getting sicker. They stay out of the hospital when they're healthier, and because it's so expensive to have medical care now. And they're coming in and they're sicker and sicker, and it's a lot more to deal with. Bullying is happening in the workplace, I'm very sad to say, between fellow coworkers, between the client, which is a family member even, or the patient themselves. They might be emotionally, verbally, physically abusive even. We hear about that a lot. And all of this, long term, can really push down on your empathy. And people hear about sympathy. I'm going to ring that bell again. Sympathy is feeling like you know what they're going through. I'm sorry for what's happening to you. Empathy is what we're called to be in the nursing field, is understanding. I can put myself in their shoes and say, I can understand why they feel a certain way, or I can picture how they feel because of their circumstances. And burnout is what we call it, when you have long-term loss of those feelings of empathy. It's usually from a lack of support. So be a good team member. Support those around you. Support your fellow techs. Support your nurses out there, and help them feel like they're not alone, that they have a support network at work. And because of all this, we are never needed more. Nurses and CNAs, I mean, oh my gosh, you have no idea how needed you are. Maybe you do, from the way we've gone out into the field. But we have a chance to be different, to act as a beacon of empathy and advocacy for our patient, for our clients who, they may not be assigned to your care, but you can't just look past the baby that's there, who may not be getting fed well, or the family member who might be in an abusive situation at home. You are the person for them, and it takes a lot out of you to do that. So that's a lot of negative things I just said, but that's you get to be that for someone, okay? So you get lots of choices and chances to do different things in nursing. One of them, most of you will probably go into medical surgical nursing areas, and that's just where someone's sick, pneumonia, or I had just had surgery on my gallbladder, that kind of thing. Majority of patients go there. You could also end up in the PCU, progressive care, intensive care, long-term care, pediatrics, hospice, home health, clinics even. Lots of different ways you can use your certificate once you've gotten it. And then beyond all of this, you may choose to go further. You may say that this is where I'm supposed to be. I'm meant to be a CNA, and that's awesome. Oh my gosh, people, I know friends of mine, fellow students of mine who went on. I was class president, and my classmates just have gone on to do other things, and that's great. But we need more bedside nurses. We need more CNAs. We need people to sit in there with the patient, hold their hand, and tell them what's going on, explain things to them. You could go on and be an LPN with a clinical hands-on focus. You could get your bachelor's in nursing and be an RN, which is that's like the gold standard of the bedside nursing right now. Professional nurse, where you're involved in planning and coordination of care. You are focused on evidence-based practice, and there's all kinds of pathways for you to go in that. You could get your master's and help more with research experiences, and you could affect nursing practice through administration or education. You could get your PhD and be focused on research, and then focus on educating future nurses. You might want to be a pharmacist and dispense and educate on medicines. You could choose to be a DNP or FNP and become a provider with physician supervision, or be a PA and work directly with physicians. Or you might want to be a physician. Who knows? The sky's the limit. There are all kinds of ways you can use your healthcare experiences, and being a CNA is where everyone should start, in my opinion. Without this experience, people don't know what the roots of healthcare are. You are doing what needs to be done for the patient when they need it done. It's not this big pie in the sky idea, like let's plan the great ether of healthcare right now. This is, my patient needs to be taken to the bathroom, or they need their food fed to them. It's critical, important work. And so those are my words of encouragement coming up, all the different ways you can be in your nursing career. Resilience is incredibly important, because a quality of healthcare worker is not made by how well they do their job. It's by how well they bounce back from their mistakes, because believe me, we all make mistakes. We don't do things the best way the first time. So bounce back and remember that you are stronger than you may think you are. Perseverance is really huge. Push yourself until your potential is tapped. Okay, so just like I said, you might say, I'm in the field I want to be long term. You might say, I don't feel like my potential is bigger than I'm using right now. Go for it. Push yourself. It may cost you bunches of money. I know, believe me. I got the debt. I know. It's always going to be there, but what's more important, your bank account or how well your heart feels when you're doing your job every day? So much encouragement has to be given in your work-life balance. You go to work and you might be searching for those overtime hours. You might be saying, I know I only need to do 3 shifts a week, but I could do 5 and get that overtime. And that's great. It's great. Some days, that's awesome. That's what you need to do to support your families. But don't forget your family, and don't forget your significant others out there. They need your support just as much as your patients do. They might need the money, but they also need you. Positivity. Because believe me, there's a million things at work that are negative. People out there who want to pull you down to their level, to say that this place is awful, I can't believe we work in this system, so many things are going wrong, things don't work. But all you really need is one positive thing to hold on to make it worth your day. Curiosity, hugely important too. It's your job to be the advocate, and even if it rocks the boat, you need to bring things to the attention of your nurse. Even since I've become a nurse, I realized there are things that I'm glad my CNA badgered me about their temperature. I'm glad they badgered me about the fact that they haven't peed in like 8 hours. Things like that need to be brought to my attention. Sorry for all your healthcare people. That's important stuff. Pooping and peeing, we get really excited about that. Yeah. Your patient hasn't pooped in like 3 days. I'm like, oh my gosh, yes. I'm never thought I'd be in that position. But bring it to the nurse. Don't feel like I'm just the CNA. What you have to bring, even if you feel like it's not important, it probably is. It could be. And don't let them make you feel like you're less than because you brought up an issue with the patient. Teamwork, of course. You are a very, very important part of the team, but remember, you are just one part. You can't be everything to everybody at all times. I used to be that way where I said, I can do that, sure, I'll do it. And that's awesome, but you are only one person. So make sure that just as much as the RN likes to delegate, you can say, no, I'm actually really busy over here. Can you do that for me, please? And then finally, communication is so important. You have to be open with your team. You're all on the same team. You're all serving the same purpose, even if it doesn't seem like it. And make them realize that without that communication, errors happen. And medical errors, we hear that a lot in the news. That's how problems happen. That's how injury and even death can happen, is when people don't communicate openly about the situation. I hope I haven't spoken too quickly. My mind runs really quickly, so if my brain gets an overdrive, my mouth just can't keep up sometimes. So talk to me afterwards if you get confused. I'm sure to answer questions. I love answering questions. So what's a good speech or graduation without a couple quotes to connected to. The first one is by the illustrious poet and author Maya Angelou. People will forget what you said, people will forget what you did, but people will never forget how you made them feel. That's so important. Patients come into the doors of the hospital and things happen to them, they don't even realize what's happening. They get given medicines, things happen to their bodies they can't even understand. People talk to them, ask them questions, they answer the same question 75 times. Sometimes that's for good reason, but they don't know what's going on. They may not understand what you did to them or how you helped them in any way, but when they walk out the door, they're going to say thank you. They're going to say thank you for taking such good care of me. You'll never know how that makes me feel. And they may not even realize in the moment. They'll write a letter later, or they may never write a letter, but you'll be in their memories, in their heart for the rest of their lives. And the final one is by someone unknown. To the wrong person, you won't have any worth, but to the right person, you'll mean everything. So you're not just a CNA, you are a critically important part of the healthcare team, and to the right patient, you'll mean everything to them. So thank you for letting me speak, and congratulations.
Okay, we would like to take a moment now to honor a few of these students